So looking at physical examination findings for cardiomyopathies. Physical examination findings for cardiomyopathies is more of like, okay, if a patient comes to the clinic, then after taking a history of this patient, you are now suspecting that what the patient has a cardiomyopathy. That's a disease of the heart muscles, right? So now on physical examination, what are the things that you must keep in mind? All right. What are the things that you must keep in mind so that you don't miss it out? What are the things you are looking out for? All right. So physical examination for cardiomyopathy. So here is a more detailed list of what physical examination findings for cardiomyopathies, like things you are looking out to see. So you are looking out to see if the patient is what fatigued. Also looking out to see if the patient is weak. All right. You are checking for weight loss. You are looking at their extremities or face to see if there's what accumulation of fluid, which will result into what edema, which is swelling of some body parts. All right. You are looking at the skin to see if the skin is pale. You are looking at cool extremities, like if the extremities, the temperature is not extremely cold and all the stuff, right? You are looking at all the stuff. Then okay, general findings. This is general findings. Okay, general. On physical examination, you do the general examination. Then next you do what? The specific examination to the system that you know that what is affected. Okay, so if you want to now examine the cardiovascular system, you are using your stethoscope and you are checking out for irregular heartbeats. Is the patient having irregular heartbeats? Are they having murmurs? Are they having a Gallop rhythm, like added heart sounds like S3 and S4? All right. Normal heart sound is lobbed up, lobbed up. So you're having lobbed up. Okay, that means there's an added sound and all the stuff, right? They are checking for the jugular vein. You're asking them to turn like this so that I can check for the jugular vein and see if it is what? Raised or distended. All right. Then also you're checking out for hepatojugular reflex. You're checking out for carotid bruits, which are abnormal sounds in the neck arteries. You are checking out for decreased peripheral pulse. All right. Then other signs of heart failures include if you hear rales or crackles in the lungs, if you hear wheezing in the lungs, if the patient has ascites, that's fluid in the abdomen is so full, all right. Then if the patient has some peripheral edema, if they have some ankle edema, if they have sacral edema, all these things are pointing you towards what? Heart failure. All right. So this everything together here how will I say it? Com okay. Everything together actually makes up what the physical examination, all right, the possible findings for cardiomyopathies.